Moving on, CPR Chart. Okay, this is also available on Google. If you want to have a copy of this, you can download. Google search Surefire CPR, the ultimate CPR guide. Okay, there's adult, child, infant, and also for pets. Okay, according to ASHI guidelines 2015 on adult, child, and infant, when we talk about compressions for adult, 2 hands at the center of the chest, lower half of the breastbone, and for the child, 1 or 2 hands on the lower half of the breastbone. For infant, 2 fingers on the breastbone just below the nipple line. On depth, for adult, at least 2 inches or 2.4 inches in depth, and for child, about 2 inches or at least 1/3 diameter of the chest. For infant, about 1.5 inches or at least 1/3 diameter of the chest. For the rate, 100 to 120 times per minute. And remember to push hard, push fast, allow the chest to fully recoil, and minimize interaction. Let's talk about high performance CPR for adult. Okay, the finger needs to be, or it can be interlaced or not. Okay, as long as you give the chest compression at the center of chest, that's all right for me. Okay, let us remember to allow the chest to fully recoil, as you can see on this illustration, and elbows lock. Okay, lock your elbows, and when you perform the chest compression, the rate is 100 to 120 compressions per minute, or in the tune of Staying Alive. And the depth for adult is at least 2 inches 5 centimeter or to 2.4 centimeter, and your action of your arms will be piston like action. And as you can see, the fulcrum will be from your hips, and your effort arm or your movement is from your upper trunk up and down stroke. And remember to place the heel of hand on the center of chest. Okay, now the question here is when to stop CPR. Continue CPR for how long? Okay, remember, stop, S-T-O-P. Spontaneous breath restored, S, or return of spontaneous circulation. Turn over to medical services, T. Operator is exhausted to continue, O. Physician assume responsibilities, P. Okay, out of strength does not mean tired but physically unable to continue. Okay, if you're tired, your quality chest compression can be compromised. Now let's talk about the recovery position. If someone is unresponsive and breathing, then you need to turn them onto their side and into the recovery position to keep the airway open so they can still breathe. That's the recovery position for infant. On the middle, child, and the last one is adult. Now let's talk about the 5 C's of lay CPR amidst COVID-19. Okay, if you want to have a copy of this, you can simply scan the QR code, and this will direct you to my page, in which I also uploaded this copy on my fan page, Autism Response PH, for everyone's guide. Okay, so this is how we are going to perform CPR during COVID-19. Remember the 5 C's. First C, check. Verbalize by clearly calling out to the victim. Visually inspect from a distance if there's movement and breathing. Second C, alert fellow bystanders. Activate emergency medical services. Ask for AED or call 911. Third C, cover yourself with a face mask and cover the patient also with a face mask or cloth. And on the fourth C, compress. Position yourself near the victim's chest. Press firmly with the heel of your palm. 100 to 100 chest compressions per minute. And lastly, fifth C, attach the AED pads and listen for instruction. Evaluate if there is a shockable rhythm, then deliver the shock. Here's the video of example of the hands-only CPR amidst COVID-19.
On the Medical Watch, saving a life in the time of a pandemic. Our behaviors have changed. Social distancing and masking are now part of our daily routine. But doctors want to remind us there's something else we can do to help those around us, CPR. The technique can be done safely, even as COVID-19 continues to circulate.
So the most critical thing is that you use both your hands and the heel of your palm here in the mid-center of the chest.
It's still the same drill. Steady compressions, 2 inches in depth, about 100 per minute.
There is a potential risk that you may break a rib, but that's totally okay.
Dr. Cpr Chatini Shah showed us how it's done, right on the sidewalk outside University of Illinois at Chicago Medical Center, where she's an emergency room physician and has witnessed firsthand the benefits of bystander CPR.
It gives me the chills right now just thinking about it because it makes such a difference.
It's a scenario that could play out at any moment, at home or out in the community. A person collapses due to cardiac arrest. The heart has stopped pumping blood to the brain and other organs.
It can happen at Starbucks. It can happen anywhere in the city. It should be almost instantaneous. Someone is not responding. They're not waking up. If you start to do compressions, they wake up, great. No harm done. Maybe they're going to be a little sore. Nothing else. But there's no barrier that should prevent you from doing it.
But would you jump in to help a stranger? It's a question bystanders may ponder during the pandemic.
If you are a bystander and a stranger falls down and is unconscious and potentially has had a cardiac arrest, if you can place a mask on yourself and place a mask on the patient and then perform compressions, then you are at a much lower risk of potential transmission to yourself. No studies have really shown that there's a confirmed risk of aerosolization of the virus. So the jury's still out on what that actual risk is.
But the risk to the fallen patient is known.
For every minute that a CPR is not performed or hands-only compression is not performed, there's a 10% less chance of survival. So within 10 minutes, you have a 100% chance of pretty much dying. Around 4 to 6 minutes is when you start to have brain death.
When it comes to kids, the recommendations are a bit different. Compressions and breaths.
Most children have a cardiac arrest because of a respiratory problem, so it's very critical that you do compressions and breaths for children, and cap back on the chest and continue to do 30 compressions to 2 breaths for at least 5 cycles.
As part of the Illinois Heart Rescue Team, Dr. Chatini Shah wants everyone to take a few minutes to refresh their skills during what is CPR and AED Awareness Week. It just takes a little practice. Think of the beat to the song Staying Alive as a guide.
The only feature that you need to know in order to administer CPR is that they're not responding. If they are not waking up, you are going to do no harm in actually administering CPR.
And here's why it's so important in this time. Doctors are now seeing an uptick in out-of-hospital cardiac arrests, likely due to the fact that people go to the hospital during the COVID-19 crisis. There are online resources that can walk you through a quick refresher CPR course or teach you the basics.
I think humin uh nagkaroon ulit ng ayan na ulit.
Sorry. Yan. Okay. Sorry, I mute myself. Okay. Back to that video. Okay. That's our video presentation for the hands-only CPR. And here, I would like to remind everybody to always follow the minimum public health standard. Face mask, face shield, wash hands, physical distancing, avoid crowd, and if not, intubation is just around the corner. Okay, this will be the hardest part. Okay, if you got positive on COVID-19. Now, here's my certification. I would like to share my credentials to you as a emergency medical technician. Okay, let us remember to have a medic or nurse on duty during school activities such as Paralympics or Special Olympics. Okay. Epilepsy versus seizure, or epilepsy and seizures. Okay, so let's talk about this. The incidence of seizures in emergency medical care is high as 30% of their emergency calls. A seizure or convulsion is a temporary alteration in consciousness. The different types of seizures can be classified as generalized, partial, and status epilepticus. Some seizure disorders, such as epilepsy, are congenital, which means that the patient was born with the condition. Regardless of type or the cause of seizure, it is important for you to recognize when a seizure is occurring or whether one has already occurred. Reminder, don't put anything in mouth. No spoon, no fork, no rolled towel or folded folded napkin or handkerchief to prevent biting the tongue, as they say. Okay, so the first aid here is ease the person to the floor, clear the area around the person, cushion the head, loosen ties or anything around the neck that may make it hard to breathe, time the seizure, call for help. If ever someone took a video, you may be asked for a copy. You can use it and share it to the doctor in ER, but never on social media. Okay, so that's how you address seizure. Okay, and always remember, first time seizure, it is automatic and emergency. Okay, next one, suicide. Okay, so please take note of these crisis hotline numbers. And about suicide, let's always remember or keep in mind about the facts. Okay, so these are the things that we're going to look for: feelings, action, changes, threats, situation. With regards to feelings, expressing hopelessness about the future; action, displaying overwhelming pain or distress; changes, withdrawing from friends; changes in social activities, anger or hostility; sleep disturbances; threats, talking about or writing about or making plans for suicide; situations, stressful situations involving loss or change, trouble at home, in school, or with the law, or sometimes can be bullied at school. Suicide overdose. Reminder, do not make the person vomit or give them anything to eat or drink. First aid, stay calm and call for help. Bring the pill contents, container or what's left of the medication to the hospital. Another certification that I would like to share to you from the Stop the Bleed, being a ambassador and instructor of the Stop the Bleed from the American College of Surgeons. Okay, some of images shown during this presentation may be disturbing to some people. The number one cause of preventable death after injury is bleeding. Suicide, deep wrist injury. The following slides will help you and guide you to do better than what we are seeing from this photo. Okay, the only thing more tragic than a death is a death that could have been prevented. Okay, this happened at home. For sure, you have a towel, you have something like a belt to use a tourniquet or to compress that wound to prevent that from bleeding continuously. Okay, from the Stop the Bleed course, there are 3 types of responders who when properly trained are crucial to saving victims with severe bleeding. And we are the immediate responders, the family driver, the yaya, the cook. We are the immediate responders. Then after we call 911, the professional first responder arrives. After they arrive, care on scene, transfer to definitive care. There you go, the trauma professionals. Okay, so we are the immediate responders. So we need to learn basic first aid or how to stop the bleed. Okay, this one, stop the bleed, you can use this if there is an accident at home, school, workplace, outdoor, vehicular accidents, or active shooter, or what we call shooting incident. Okay, you can do the stop the bleed. Okay, we learned a while ago the 5 C's, the 3 C's. Now, when it comes to stop the bleeding, we have to learn the ABC. A, alert 911 or call for help. B, bleeding, find where is the bleeding. Then after you found it, C, compress or you apply wound dressing or wound packing. Okay, let me repeat this. The only thing more tragic than a death from bleeding is a death that could have been prevented.